Meantime, long COVID cases are emerging as a serious concern. Researchers say between 10 to 30% of all COVID-19 patients suffer from symptoms long after their initial infection. With treatment options unknown or very limited, therapies used to treat brain injuries are actually giving some long COVID patients hope for the very first time. News Center Maine's Vivian Lee has the story from Scarborough.
For Cynthia Hamilton, daily life is very difficult.
Taking a shower takes 3 hours because I get so short of breath putting my hands over my head trying to wash my hair.
There are also sudden rashes, severe fatigue, loss of appetite, and debilitating pain. Symptoms so bad, she had to quit her job as a school guidance counselor.
The pain will go to my shoulder. It will run down my shoulder to my hand.
When the joint pain began in June of 2020, Cynthia, seen here with her husband Lonnie, was diagnosed with fibromyalgia. After testing positive for COVID-19 last May, doctors said she actually had long COVID, a condition where symptoms continue or increase long after the initial infection. Despite seeing numerous doctors, tests and scans at a post-COVID clinic at Beth Israel Deaconess Medical Center in Boston, more problems emerged, from brain fog to anxiety.
It has attacked every part of my body.
Her doctor recommended brain-based therapies at the Scarborough Neurodevelopment Center, including a computer-based program called Interactive Metronome. When Cynthia hears a tone through these headphones, she tries to tap and sync with it.
You hear a tone, you try to match exactly with your motor, with your hand, match that as the beat occurs. So what that's doing is it helps to form new neural connections.
Suzanne Sylvester is a speech-language pathologist who is treating more patients with cognitive problems connected to long COVID.
Let's try to get around the mask here.
Cynthia also does weekly sessions of cranial electrotherapy stimulation to manage anxiety, depression, and insomnia. An alpha stim device sends a small current that increases alpha waves across the brain. In treatment since the fall, her memory skills are better and she feels calmer.
I don't want to just treat the symptoms. I want to heal. I want to be whole again.
And hopefully the beginning of getting her life back. In Scarborough, Vivian Lee, News Center, Maine.